Welcome. This video will demonstrate the physical examination of the ankle and the foot. This is pretty straightforward. The clinicians might palpate many different joint areas, and in general for the palpation you can just mark it as negative and document the areas that are positive if there are positives. There are a couple special tests that I'll show you that we will do, especially for the ankle. So for the ankle, we're going to do some range of motion. So I'm just going to assess his flexion and his extension. And I would say his ankle flexion is slightly limited. We're also going to assess inversion and eversion. That looks pretty good. So that's for the ankle joint itself. The next test is similar to the knee. And this is going to be an anterior drawer where we're testing the stability of the anterior ankle ligaments. And then we're going to do a posterior drawer where we're assessing the posterior aspect. So for anterior, I'm going to grab at the heel and I'll be pulling forward. That's nice and stable. Posterior, I'm going to be at the front of the ankle and pushing back. That's nice and stable. A lot of times people will complain of Achilles tendonitis, so I'll palpate that area and where it inserts. We're also palpating the myotendinous junction up a little higher. Any tenderness through there? Great. All right. The ankle is an area similar to the wrist where we will rely a lot on the ultrasound to help us identify if any of the tendons that cross the joint are involved with the patient's chief complaint. Also, it will help us evaluate for the ankle joint, the midfoot joints, and the distal foot joints, about forefoot joints, whether or not they have significant arthritis or degeneration. So next, another common area of complaint is the plantar aspect of the heel, or plantar fasciitis. So in a general ankle exam, we will commonly palpate here where the plantar fascia inserts. Any tenderness there? Great. So we kind of assess for that. I'm also assessing for nodularities. I'm not feeling any. You don't really have to document the nodular part unless there is one, but definitely mark that the plantar fascia was negative. If we think that there is any neurologic concern, then we will do our familiar Tinel's test at those nerves. So for instance, there's a nerve that wraps under here, if we're tapping there. So any tingling, numbness. So this would be at the tarsal tunnel. Tinel's is negative at the tarsal tunnel. Then we're going to palpate the joints of the midfoot. Any pain with that? Okay. If you have any pain, let me know.
Okay.
Palpating through here.
Okay.
Great. All right. Now, the clinician, they usually won't call this out, but they are evaluating the skin in all these areas. We're evaluating the skin, we're evaluating for swelling, we're evaluating for deformity of the joints, and if we will see it, if we see it, and we will call it out to document it. But as we're scanning, just assume that it's normal unless we call it out. So he doesn't have any obvious deformity there. Sometimes people will have what's commonly referred to as a bunion or hallux valgus of the joint here. We'll call that out if we see that. Another special test for the foot is called Mulder's sign or Mulder's click. If we're assessing for a neuroma, we will palpate in between the toes, because that's where they live. Any tenderness there? Great. So he's not tender in the inner metatarsal space. Then what I'm going to do is I'm going to grab at the joints here and I'm going to squeeze. What I'm doing is I'm one, assessing to see if that causes any symptoms for you, okay, and two, to see if I feel any clicking of the neuroma going in between as I squeeze it, and I'm not. So Mulder's squeeze and click are negative for him. Otherwise, for the ankle and foot, we rely on the ultrasound for the rest of the exam. So, thank you. If you have any questions, let us know.